It's been a day of reckoning for those involved in the infected blood scandal, the country's worst healthcare tragedy. Between 1970 and 1991, more than 30,000 people across the UK, including 3,000 in Scotland, contracted HIV and Hepatitis C after being treated with contaminated products. Today's public inquiry report found the tragedy was no accident, but the result of a catalogue of shocking failures. Scottish findings reveal that haemophilia patients were used for AIDS research without their knowledge. And children at York Hill Hospital received high-risk blood products sourced from the United States. After concluding his 5-year investigation, the inquiry chair, Sir Brian Langstaff, called for culture change across the NHS.
What I've found is that disaster was no accident. People put their trust in doctors and the government to keep them safe, and that trust was betrayed. And then the government compounded the agony by telling them that nothing wrong had been done, that they'd had the best available treatment, and that as soon as tests were available, they were introduced. And both of those statements were untrue. That's why what I'm recommending is that compensation must be paid now, and I've made various other recommendations to help to make the future of the NHS better and treatment safer.
The political world has today been united in its backing of the inquiry report, and tomorrow the UK government is expected to allocate more than £10 billion in compensation. The administrations at both Westminster and Holyrood say they're determined to ensure that lessons have been learned.
This is a day of shame for the British state. Today's report shows a decades-long moral failure at the heart of our national life. Layer upon layer of hurt, endured across decades. This is an apology from the state to every single person impacted by this scandal. It did not have to be this way. It should never have been this way. And on behalf of this and every government stretching back to the 1970s, I am truly sorry.
This is such an important and also long-awaited report, and having been in and listened to Sir Brian Langstaff's reflections on it, it just shows how much this report means to everybody. I think learning from this report is probably the most important thing that we, the Scottish Government, can do.
Thomson Solicitor Scotland represented hundreds of individuals in the infected blood inquiry. The firm's lawyer, Lynn Carey, was in London today for the report's launch.
The report really does highlight a number of very, very serious failings that have taken place over a number of years, and these failings have caused pain and suffering to a large number of people who've been infected and their families over a number of years that has really impacted every single aspect of their lives.
This was a UK-wide inquiry, but there were certain specific differences to do with Scotland.
Yes, that's correct. In Scotland, the mainly blood products were produced in Scotland rather than being imported from the rest of the UK. The report does highlight failings in the way that blood was collected, risky practices that were adopted in terms of collecting blood from prisons and other risky sources in Scotland. One area that should be highlighted where commercial products were used in Scotland from America was in the treatment of a number of children with haemophilia in York Hill Hospital in Glasgow that led to a number of children contracting HIV and tragically dying. And the report states that the consultant at York Hill Hospital, Dr Willoughby, did not take into account the best interests of his patients in using those products.
The one thing I'm struggling to understand is why did this happen? It was clearly, it was wrong and it was never corrected soon enough, but why did it happen in the first place? Why were these risks taken?
Well, I think the I think it's clear that the risk of the virus just wasn't taken seriously enough, and there wasn't a quick enough reaction once those risks should have been apparent to take action to stop many people becoming infected, and that was avoidable. And as the chair of the inquiry said today, that was not an accident.
And there were missed opportunities again, specifically in Scotland since devolution, opportunities to maybe correct this.
Yes, that's correct. There was a number of opportunities early in the life of the Scottish Parliament where there was an internal investigation by the Scottish Executive at the time, but the report identifies some failings in the way that was conducted, so that was certainly a missed opportunity. There was also an inquiry in Scotland called the Penrose Inquiry, which reported 8 years ago and didn't identify these failings.
Lynn, thanks for joining us in Scotland tonight. It's been an emotional day for those personally affected by the infected blood scandal. The chair of Haemophilia Scotland, Bill Wright, contracted hepatitis C in the 1980s when he received contaminated blood during treatment for a minor injury to his thigh. He has spent decades campaigning for justice and spoke to us this evening from Perthshire. Bill, a seismic day for so many people involved, but you had to watch proceedings from your home.
Yes, unfortunately, the irony being that 38 years ago, I myself was infected with hepatitis C from a concentrated blood product. I then developed liver cirrhosis. The irony being that a couple of months ago, I was diagnosed as a consequence having liver cancer. So I can't be in London.
You've campaigned for years for the justice of victims of the scandal. So how does today feel to you?
Well, I think someone said earlier to us today that this is a triumph. But I think what has to be borne in mind here that there are no winners. There have been far too many deaths. There have been far too many lives blighted, both physically and mentally. Harm upon harm has been heaped upon people. So yes, indeed, we feel vindicated, and we feel actually that a lot of the truths that we started to know and became clear during the evidence when it was presented to the inquiry was the case, that we feel vindicated. But nevertheless, we cannot bring back the people who died.
You appeared on Scotland Tonight 9 years ago talking about this. This was just after the Penrose report was published. And although many people thought that was a whitewash, you were very optimistic. How did you manage to maintain that optimism?
Well, there was some evidence that came out during the Penrose inquiry that wrongs had been done. But there were two differences, and there's a stark contrast between the inquiry that's just reported for the UK and the inquiry that took place back then. First of all, the remit for this inquiry has been much wider, and it's covered the whole of the UK. And that's important given that most of the harm happened prior to devolution, and the decisions by government, the key decisions that were made by government were made back then. And the other thing is the leadership of this inquiry has been very different to that back then. And I think the difference being that we've really felt that we've mattered during this particular inquiry. And that's been to the benefit of the inquiry in terms of the evidence as it's come out. Because Sir Brian has drawn on the evidence, he's listened to people. And that's actually helped him to look at the places where he needs to ask questions within the medical profession, within government, and in particular within the civil service.
So Brian Langstaff was particularly damning about how figures and authority were dismissive to the many victims. How do you feel when you try to raise these concerns with them?
Well, we were dismissed. We were made to feel we didn't matter. One of the most hurtful elements in this story was back in 1999, we served, 25 years ago, we served a petition in the Scottish Parliament calling for an independent public inquiry. What then happened was that the then Health Minister asked the Deputy Chief Medical Officer to go away and prepare a report. that medical officer had themselves been a haematologist, and lo and behold, they prepared this internal report saying that nothing more can be done. Well, today absolutely shatters that claim. Sir Brian himself has said that most of the infections could have been avoided.
So what should happen now?
Well, I guess the ball's very much in the court of government now. But one of the messages that's come through loud and clear is that government cannot resolve this alone. They actually have to involve the whole of the rest of civic society, because this is an earthquake in terms of the way that we do government, both in Scotland and in the UK as a whole. This is basically looking very fundamentally at the way in which disasters are dealt with, in the way that candour is addressed, that rather than have cover-up and defensiveness, we need to get to the point where doctors and indeed civil servants and ministers in particular need to be able to report on near misses. Today
was all about the report. Tomorrow we're expecting to hear about compensation from the UK government, figures of £10 billion being quoted. Can any compensation be enough for you?
Well, it's very difficult to put figures on people's lives. I do think it's a very important element of this, because I think for a lot of people, how can they actually get recognition for all this harm upon harm, or series of harms that people have had to experience? And certainly, some people have completely lost their livelihoods, lost their incomes, and that obviously has to be compensated. But we also have to compensate for the other things that people have experienced. And I do think that that's clearly, there's a lot of pressure now on government to act upon this, and they need to involve patient communities in agreeing the system of the package of compensation, and that potentially also has to involve, frankly, for some people, legal support, because their claims will be very complicated.
Well, best of luck with the treatment bill, and thank you very much indeed for joining us in Scotland tonight.
Thank you.